You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right, good morning. Welcome back to Insurance Matchmaking. I kind of teased this last week, but we're going to talk about medical expense shield, the two-layer safety net. Today, we're going to talk about a hybrid health plan, and that not only protects you from being met from big medical bills, but also can be a lot easier on your monthly budget. You've probably heard me talk about the Affordable Care Act, the Affordable Choice Plan that's offered by Manhattan Life, and I still like that plan. It is very affordable, but you do have to qualify medically for that plan. But it'll help cover a lot of your big expenses. But this plan I'm going to talk about today, this medical expense shield, does what I've been trying to get people to consider, and they're going to put it. And I will say I generally don't say company names when I am on today, because I'm really going to kind of dig deep into this plan. It's from Allstate Health. I've been writing Allstate Health short-term plans, and they have their dental plans and things like that, and the accident plans. So we've written a lot of those. I wrote a lot of their Trio Med this last year to fill the gaps for when people have a bronze plan through the marketplace. So I've recommended people do this, but it gets a little confusing sometimes for their providers, is going with a high deductible, and sometimes the highest deductible health plan, and then fill that gap with a fixed benefit plan. What I love about what Allstate's done here is they've kind of married the two. So let's dig in here. You know, like I say, let's be honest, health insurance today can feel expensive and unpredictable, high deductibles, rising premiums, and plans that don't always fit your situation. One of the things that happened this year with the taking away the enhanced tax subsidies, people of a higher income were still getting a halfway decent subsidy on a marketplace plan, and when that went away, now they had to pay full price for a marketplace plan, and that was not affordable. I've mentioned. So we've moved some people to short-term plans. We've moved some people to affordable choice to help cover those things. But the short-term plans, they fit many different needs. One is just, hey, you're between jobs, you need something that will cover you for the 3 to 6 months until you land that new job, or you maybe have to go through that waiting period of 90 days. A lot of places aren't doing that now. There's kind of like, I think it's part of their recruiting of, hey, day one, if we hire you, you have health insurance. Other companies are still going to do 30 days. 60's got rare. It's usually 30 or 90. But you go through that kind of probation period, and they save on their, hey, they're not paying you for insurance because, 40 days in, you may decide you don't want that job anymore. And then they never had to pay anything for you for health insurance. So there is that. So that's where, again, a short-term can come into play. A lot of people will take one just kind of for that catastrophic coverage of, hey, if I get a $100,000 medical bill, I don't want to lose my house because I have to sell it to pay my medical bill, versus even with a $25,000 deductible, at least hey, I just got to be able to come up with $25,000. And you can get a home equity loan or a personal signature loan. And again, medical bills, as long as you're paying on them, that doesn't necessarily mess up your credit. So there's ways that you could come up with a way to cover that $25,000 and not lose your home. $100,000, you're really going to have to pay that, get that down quicker. And so we don't want you to have to do that. So we want to make sure you have some kind of insurance in place, but you still need that coverage to be affordable. So that's kind of what we're doing. So this is one of the things that we're gonna match, the medical expense shield. And you may ask, what makes this one stand out? It takes the two things that I've been doing, and what I've been doing a lot of times, like I said, is putting somebody on a high deductible plan and then put them on a fixed benefit plan. But they end up sometimes having two cards, and you present two cards sometimes to the doctor's office. They just look at you like you're crazy. They'll take the one that looks most familiar to them and hand you back the other card. And so now maybe you have to file a claim yourself to get it paid. I had a plan before, and it's still available, that you would do, again, a high deductible plan, but have that fixed indemnity plan from the same carrier. And they just kind of streamlined it. Was you give them the one card, they know you have the plan, they still apply, you use the plan that paid for the cost, but they still applied that to your deductible. on your main health plan. So it was like maybe give them that one card and you'd be good. But it did confuse people a little bit. But that's kind of like what this plan is doing. It's marrying a high deductible health plan with a fixed benefit plan. So that fixed benefit plan is going to pay for that doctor visit, for that x-ray, for that surgery, for that hospital stay. But that cost that's being billed is still, paying that, even though it's maybe covering the whole cost or covering a big chunk of it, that's still all going towards the deductible. Now, one of the things that's really going to freak people out, but I'm going to go ahead and hit it here early, is this Medicare Expense Shield. I don't know if I'm going to call it MES or not. Probably will eventually. I like the name, though, Medical Expense Shield. There's two deductibles. There's a $25,000 and there's a $35,000. And then there's a couple of different options, and I think it has to do with the rate of paying back. So that you have a core, and then you have I think they call it plus. I probably should have made notes on that, but. So it will pay a little, cover a little bit more of the cost for certain things, or the per day in the hospital is higher, something like that. But you're going to pay more per month for the plus. So that may or may not be. But I priced for a family the other day, and it was like from $500 to maybe about $800, just depending on those options. But the marketplace for that family was going to be $2,200 or $2,400. It's quite a bit less, so that it can be 50% or lower than that cost. But so what it does is it'll pay the cash, like I said, directly to you, so to speak. And a lot of times, again, as we've talked about indemnity plans, we talked about it last week. Indemnity plans pay you, but you can assign those benefits to the provider. So the beauty again here, you're going to have one card for this plan. So when you go to the doctor, you're going to give them that card. When they go to contact the carrier to submit their claim, it's going to come back, we're paying this much for this procedure. Well, that procedure may be less or more than what you're being billed. And again, with these indemnity plans, the way they work is if the bill or the charge for the service is less than what that scheduled amount is, they send you the difference in cash. Like I said, and you actually put it in your pocket. You still get credit for paying that bill towards your deductible. So you've already met that. And there's a couple of, like I said, there's going to be $25,000 or $35,000 to the deductible, but once you hit that deductible, that plan's going to pay 100% of your costs. And these plans, I'm going to forget the Medical Expense Shield has a $5 million coverage cap. Typically, most short-term plans are $100,000. I mean, $1 million. There are some that are $100,000. They're $1 million or less typically. There may be one or two out there that's like $2 million, but generally they're $1 million or less. And of course, the lower that max that they'll cover lowers your premium. So a lot of people, younger people have that tendency of, probably nothing must happen to me. I might have an accident and get hurt. I'm okay with the cap being at $250,000 because I'd much rather pay $30 a month than $60. And that's kind of the way it boils down to, that they'll choose a lower maximum coverage to save $20 or $30 a month. And I understand it. When you're young, you're not making a lot of money. And especially, these plans do work for people who are under the minimum income for the marketplace, so they don't get a subsidy. Those short terms work for that. This plan here probably wouldn't work for somebody like that. These plans are going to be more for those that, hey, I can pay for my insurance, but I can't afford that marketplace plan because I don't qualify for subsidy. This is who's going to fit for these. The downside, again, they are medically underwritten, so not everybody's going to qualify. Those pre-existing conditions can knock you out. So, we will figure that out for you. I talked about that last week on the show. Is we're going to make sure that we can get you covered and not cancel other insurance before you can be covered by this or not. And some of them it's just a matter. There could be limitations for pre-existing conditions, not necessarily a knockout for that, but just a you have a waiting period. Most plans, it's going to be like 6 months. After 6 months, it's like you didn't have the pre-existing condition, and then sometimes it can be up to 12 months, depending on what's going on there. But after you've had the plan for a year, you're going to have it. But so here's kind of the a couple scenarios that would kind of show you how this plan might work. So the example here is, let's say you need knee surgery, and the total cost for that is $10,800. I love the fact it came up with knee surgery because, Chat helped me come up with these scenarios, and of course, Chat has heard me talk about my knee surgery several times because I've have it transcribe my show. So which really helps it come up with the ideas because it knows my voice. So thank you, Chat. But so that knee surgery, say it's examples given, it's $10,800, and then the cash that paid out to you based on that knee surgery was $8,100. So your out of pocket is under $2,000, but that full amount still applies towards your deductible. So that $10,800 would go to the deductible. You paid $2,000 of it. So and then if say you have a bigger event, this example wasn't, and this is not based on history on me, but it's definitely Chat's definitely heard me talk about it. Let's say you have a heart attack and the total cost is $70,000. And the cash benefits it's going to pay is around $2,100, and this is using the example of having the $25,000 deductible. Your final out-of-pocket is roughly $3,300 because now you've met that deductible. The rest of that balance towards that $70,000 is covered 100% by the insurance. So these plans can come in very handy and cover some really big medical expenses. But it's kind of, as I said before, at about 50% of the cost of what you would pay for a marketplace plan or a COBRA plan if you're continuing that after employer coverage. So let's go ahead and going to cut myself. We're not running over this time. We're going to the break here real quick, and then we'll come back in and talk some more about the plan details and get a little more in-depth in the Medicare Expense Shield plan.
Something special is building in Overton County, and you're invited to be a part of it. Join the Upper Cumberland Habitat for the Overton County Dream Builders Luncheon, Tuesday, August 25th from noon to 1 at the Live Church in Livingston. Hear inspiring stories of lives changed through home ownership and see the impact Habitat is making right here in the Upper Cumberland. Discover how you can help build strength, stability, and self-reliance for local families. Tickets are just $20 or a host table for $200. Reserve your seat at uchabitat.org. This summer, Tri-Light is turning up the excitement with a 10 Gig Days of Summer giveaway. That's 10 days, 10 incredible prize packages, and 10 chances to win big with a new prize featured every day. Winners will be announced on the Tri-Light Facebook page beginning July 7th, with the grand prize winner revealed on July 16th. Don't miss your shot at a summer full of big wins. Visit trilight.net today to learn more.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and we are back on Insurance Matchmaking. So, as I mentioned, this plan is a combination of a short-term health plan and a fixed indemnity plan, depending on which way you want to refer to it. So the short-term plan is still going to work just like the typical short-term plans. You're coupling together the 3 1-year plans. So at the end of that 3 years, to renew the plan, you would have to go back through the underwriting questions to keep the short-term coverage in place. But the fixed benefit plan will continue. So some people may elect, it's been working out for them. Maybe they've been using some of the benefits, and because they've been using some of the benefits, they might not qualify to continue the short-term plan. You could still continue the fixed benefit plan portion of it, and your premium would be adjusted, and you can continue to renew that as long as you pay the premium. Basically, and I haven't looked deeply into the details on this, but typically these plans, because short terms definitely end, I think these plans are going to end at age 65. Sometimes some of the indemnity plans, when you turn 65, the benefits will go down to like 50%. That's usually more on a specific, like a critical illness plan for cancer, heart attack, stroke, something like that. Accident plans a lot of times will continue, but the fixed benefit plans typically, they know you're going to be eligible for Medicare at 65, and so that's when these plans end, and that's part of why they keep the costs are lower, because they know that you're not going to have this plan for the rest of your life. But say you get the plan at 50, you have your 53rd birthday, you've had the plan now for 3 years, you go to reapply for it, and maybe you have had a heart attack, maybe you now have diabetes. They're not going to let you renew the plan because now you don't meet the health underwriting for the short-term plan. But you can still keep the fixed benefit plan in place, because as long as you continue to pay the premium, that part of the plan will continue. And I'm pretty sure that what will happen then is the premium would be adjusted to where you're only paying for the fixed benefit, not paying the full cost of the plan. But even then, it's still pretty affordable, because if you think about it, you're now another 3 years older, and it's still the same plan, and that premium shouldn't go up. Now, it may go up, and again, they may adjust. I don't know if they fix the premium for the 3 years. I have to look at that. I'm pretty sure that is the way it's set up. I've only ran, one or two partial quotes on it. It wasn't even available. We just got notification this is coming up. It's available now, and we could write plans to be eligible for June 1st. So I don't have anybody on this plan yet as I'm recording this show. When you listen to it, I might have a couple clients on it and have a little more time to study. So we'll come back and revisit this plan on a later show when I've had maybe a little more experience with it. But just wanted to get this out there, let people know that, hey, you don't have to keep that high cost marketplace plan if you're no longer getting the subsidy and you're just going to the doctor a couple times a year. This could be a very affordable alternative. Maybe I've already got you on a short-term plan, but this now sounds like it might be a better fit for you. We can requote. You can cancel your short-term plan at any time. You don't have, even though you signed up for 3 years for that plan, they just can't cancel you in 3 years as long as you pay your premium. But you can cancel it at any time. So if this might be a better fit for you than the plan that you currently have, we can put this one in place. And again, we would put it up to start, say, the first of the next month, which may be a couple weeks away or a week away, depending on when we meet and talk about it. Could be, most of a month away. We could request it to start the 15th of the month if it's, if we're looking at it in the early part of the month. But give a little bit of time in there to make sure that the plan will be approved. And then if you're approved, then you can cancel the other plan. The other thing, too, is usually most of the time when I put people on a plan, it starts the first of the month. So you've already paid for the month. Sometimes, you can't, they just won't charge you again. They're not going to refund you if you cancel early in the month. So, you either want to cancel before they charged you, or you say, okay, I want to cancel it as of the last day of this coverage because I'm going to start other coverage the next day. And you don't have to overlap on the days. If one plan's ending on the 30th or 31st of the month, the next plan can start on the 1st. You didn't have a gap in coverage. So kind of look at who it's a great fit for, or maybe who it might not be a great fit. But if you need lower monthly premiums, yeah, this is probably going to be a great fit for you. You're in transition. I talked about, and I think I talked about it on last week's show. It's like I'm doing two shows at once today, so sometimes I kind of forget. Did I talk about it in the first segment, or did I talk about it last week? But you might be in transition. Maybe you're in between jobs, and maybe you haven't gotten hired yet, so you're not sure whether it's going to be a 3 month, 6 month, or 9 months, before you have employer coverage again. So you probably need some short-term coverage. This gives you a little bit more robust coverage than just the short-term for the catastrophic, and it still can be affordable. And like I said, it's definitely going to be more affordable than going with COBRA coverage. I know this was last week. I talked about COBRA coverage. The only time generally I recommend people take the COBRA coverage is they don't qualify for subsidy for the marketplace, but they've already met their deductible or max out of pocket, or they're close to it because of other expenses, expensive drugs, things like that. That actually may be more affordable for them. And generally, if you're in a situation like that, you're probably not going to qualify for a plan like this. So sometimes, if you're in transition and you're in good health and can qualify for this plan, it can be a great fit, and it gives you that catastrophic coverage plus help pay for, routine health costs, so you don't have to dig deep in your budget, especially if you're looking for another job and you don't have any new income coming in. But let's be clear, this is not what's called a qualified health plan. The chat note says it's not ACA compliant. I don't like to use that term there it's not called a qualified health plan. A qualified health plan has to cover preventive, has to provide dental and vision for children, cannot turn down for pre-existing conditions, all those things that cover all those preventive costs. And maybe I just said that. That's what makes it a qualified health plan. Qualified health plans are Medicare, COBRA, Affordable Care Act, and employer coverage. Those are your qualified health plans. And in the health sharing, like MediShare, those things like that, they're not qualified health plans, but they do exempt you from that requirement. So they would be considered, I guess, compliant in that sense. So, again, pre-existing conditions may not be covered. We already kind of covered that. And in renewal on the medical side, sorry chat, it's not may, will require underwriting. After 3 years, you're going to, because that's because it still is a short-term plan. It's technically, it really is, it is a hybrid plan. It is 2 insurance plans in one. But the way they've structured it works great. Again, you're not going to be confusing the billing person, giving them 2 cards, and it's like, well, which one do I bill for this doctor visit or for this x-ray or for this blood test? You just give them the 1 card, and they file it, and the insurance company applies the costs correctly to, okay, we're paying this much for it, and here's how much amount that will go towards the deductible for the health plan. The health insurance company is making those determinations, not the clerk at the doctor's office. And again, this isn't about selling a plan, it's about making the right match. As we say, this is insurance matchmaking. We want to match you with the coverage that is going to cover you. Now, one of the things this plan also comes with, so there are some bonus features. You can have a 0 copay for virtual care. So you got to, I know Teladoc is a brand name, but telemedicine, you've got a toll-free number generally. Sometimes you can do it, register through an app and you do kind of like a FaceTime visit with a doctor. That's a 0 copay. So you can save a trip to the doctor. And there's a lot of things. If you haven't ever used telemedicine, it can come in very handy. You have an ear infection. I get this from the ladies in my family, so I can say it. Generally, ladies, when they have a urinary tract infection, they know it. They know the symptoms. They really don't want to take time to go to the doctor and sit in the waiting room and wait to tell the doctor the symptoms, and the doctor goes, yep, here's your prescription. Now you can take that to the pharmacy, versus, hey, you can call them on your lunch break, or, if it's in the evening or the weekend, you do and they send your prescription to whatever pharmacy you use, and you just go get it. So those comes in really handy. And then prescription drug coverage with one of the bonus plans gets, very, very low cost generics and things like that just built into the plan. So that comes in real handy. So there are bonuses there. And again, the company offers dental and vision. We have just regular accident plans. We can cobble together some other plans. I don't know if cobble together is maybe not the, and again, it doesn't have to be through that same carrier either. That's one of the beauties of working with someone like us that are broker. I have my agency is a brokerage. I don't work for one company. So a lot of times I may sell a cancer plan from this company and a hospitalization plan from this company, and the major medical's over here, and dental's over at this. I have clients sometimes with 4 or 5 different insurance companies for their plans, because that's what fit them and fit their budget better. So those are some ways that we can help make sure that you have that coverage. And one of the other bonuses, I always forget, it's just one of those things that's not top of mind for me, is the add-on plan that you have that has the virtual care. There also there's behavioral health services. So like if you're looking for some low-cost assistance with counseling, this actually plan comes with that. And again, I think it's a virtual, so you would be talking to a counselor. It's not necessarily going to help you pay for your local counselor. They may not be a network. And a lot of times, a lot of counselors don't take insurance. This is their cash pay anyway. Whereas this may be a way, and you maybe still want to see the counselor that you're used to paying, but go ahead and use the virtual one too. So that's up to you. And I mentioned earlier, at the end of the day, there's no one-size-fits-all solution. Some folks need to be on the ACA. Some are, it's Medicare. This plan here is not for someone who is eligible for Medicare, so call that out. So if you're looking for coverage that can lower your monthly costs while still protecting you from major expenses, let's talk. You can go to you can find my help. You can go to insurancematchmaking.com. That website is basically for the show here, but it does have a link back to my Matt Libby Insurance website. But you've got links there. One on the Insurance Matchmaking. There's links to the past shows. There is a comment reply where you can give me solutions for the show or ask a question, ask me to contact you. But you need to go to my Matt Libby Insurance page if you want to follow the link to schedule a meeting with me. And we can do it by phone. We can do that by Google Meet, like a Zoom type meeting, virtual meeting, or you obviously are welcome to come into the office. So there's 3 ways we can meet. What's most convenient for you is what we can do, and you just have to make sure it'll fit my schedule. And if it doesn't fit my schedule, I'm not the only agent in the office. We are working on adding a couple more licensed people in the agency. So we're going to match you. That's the plan. It's insurance matchmaking. It's not Matt matching. It's insurance matchmaking. So give us a call. Keep listening here on Grace 107.7. Every Saturday, 10 o'clock, we're here. And all our past shows, so there maybe I didn't cover the topics you're interested in, you can go to Insurance Matchmaking, find those YouTubes. I do have a YouTube channel is Insurance Matchmaking. Please, if you go there, please subscribe, like and comment on some of the videos. That really helps me get the word out to others that I might be able to help. And I've had a few people I've been able to help here from the radio show. And also, hey, if you go to Google, we love 5-star reviews. Those really help people know that we're here to help. A lot of people I've had, you don't know how many people have come to office and say, hey, I had to find it. I just Googled it. I love the fact you had 5, had 5 stars. You had great reviews. So we really appreciate those views, and even if it's reviews, and even if you just want to say, hey, I haven't used Matt's services, but he sure helped me a lot for the information he's given me on the show. So anyway, till next week, keep tuned here, and we'll see you next week on Insurance Matchmaking.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.